Good evening. My name is Paula Holigan. I'm the program manager for New Hampshire Project First. It's over at the Fire and EMS Academy. I'm also a firefighter and an EMS provider in the state of New Hampshire. So here's my story. Several years ago, I responded to a medical call in my community for a possible opioid overdose. I was one of the first EMS providers that arrived on scene. The scene was one that I'll never forget. The woman that was there was one that we all knew that had responded to that call. She was crying over her son who was slumped over on the floor. We did an assessment and revealed that her son had been dead for quite some time, and we suspected it was an opioid overdose. On scene, I learned from the mom, because I had a connection with her, that her son had been involved with opioids for some time. He tried to get clean several times. He always said he wanted to do it for his young daughter. The mother stuck by his side through lots of relapses that he had, trying to find help. Very difficult at that time to get help for him. And she had experienced several relapses for him, kicked him out of the house, brought him back, just trying to help. So she was really struggling as well. She worried constantly that one day she'd find him dead of an opioid overdose, and now here we were with an opioid overdose. So the law enforcement and EMS, we left her house that day and we all felt helpless. What could we have done? Could we have done something to help this family, this person, to prevent that overdose? This experience and others that followed for very similar calls like that actually led me down the path in my interest in behavioral health and substance misuse. It also led me down a path to try to find a solution that we can do to implement in the state of New Hampshire. So now we fast forward a couple of years. So my agency applied for and we received a grant, which was actually a grant to implement a program that I had an idea for. And that program was one to use first responders to help reduce opioid overdoses and overdose deaths within our state. The funding sparked the creation of this program that I'm currently working on called New Hampshire Project First. We like to call this a mobile safe station. I think everyone's probably familiar with a safe station. So basically, first responders are in a really great position to do this type of a program. We're in a great position to make connections with people when we respond to their homes, and especially with people that happen to be there that are struggling and don't know where to do and where to actually turn for things. First responders are respected. They're also trusted. When they respond to calls, they get valuable insight into people's lives, creating a perfect storm of an opportunity to intervene with these individuals. So first responder agencies that are funded with our grant for New Hampshire Project First, they receive training on opioid use disorder and compassion fatigue, and I know we talked about that a little earlier. So compassion fatigue is a side effect that many first responders experience when they have to respond to calls over and over and over because they don't understand that this is a relapsing disease and sometimes it does take multiple times to respond to individuals. So these agencies that are part of this program, what they do is they form what we call quick response teams, and they conduct follow-up visits with people, and they meet them where they are. What they'll do is they'll conduct follow-up visits with the at-risk individuals and also their family and supports who are also patients as well. And they provide life-saving training for those individuals in the form of CPR and naloxone administration. They teach them about the Good Samaritan law, so that they're not afraid to call 911 during an overdose. Ryan mentioned the naloxone kits. They'll leave naloxone kits as a harm reduction measure with cards to help them get replacements because it may take a couple of times. And what they also do is they perform some vital services for connections to our hub system in New Hampshire. In many cases, they're making the actual call for that individual for 211. It opens up lots of services for not only the person that needs the treatment to get into that, but to make that physical connection for them, but also the family members that are there struggling where they don't know where to turn. They need help too. So first responder agencies here, we've got 6 of them. So basically they're throughout the state of New Hampshire. They all pretty much started their programs in early April. And what they're doing is they're conducting, like I said, these follow-up visits. And we have one community, which is the community of Epping. And what they're doing is their follow-up team consists of 2 first responders, and they go out to over a dozen communities in the Seacoast area. All the others are working. We've got Concord, we've got Dunbarton, we've got a lot of different communities. Hooksett, Salem just signed on last week, and Laconia as well. And the one thing I wanted to mention is that this program is a community approach, meaning that the first responders collaborate with healthcare facilities, faith-based agencies, treatment and recovery, lots of different agencies to help bring this, to fruition here and find a solution. But the thing I want to mention here is that this actually, we talk about hub and spoke model, that hub includes all of you here. We're looking for your input. It's going to take a village to solve this problem in the state of New Hampshire and otherwise. So this opioid use disorder has had a tremendous impact on our state, affecting all parts of the state and all lives. So not only are the at-risk individuals at risk and need help, but also the people that are their family and support systems need that help as well. So really what I ask you to do is actually to look at what you might be able to do. Ask yourselves, what can I do to help our community and to get these people connected? And how do we fund programs? This is a funded grant for a couple more years. How do we fund solutions like this? Because those personal connections are vital for people who have lost everything. They need that hand-to-hand intervention and actually to connect them to the hub system where they can get these very vital services. And thank you very much.